Health is important. Being healthy is crucial to our well-being, for our ability to function, to connect with one another, and to contribute to our communities. I've been thinking a lot recently about what it means to be healthy. In the middle of a global pandemic, this may seem unsurprising, but I'm also a public health student, so I spend a lot of my time looking at the health of our populations. Health is a human right. This is enshrined in our national and international legislation, treaties and agreements. Consider this from the United Nations Declaration of Human Rights. Everyone has the right to a standard of living adequate for the health and well-being of themselves and their family. In New Zealand, we promote this right too. The Human Rights Commission affirms across many of their documents that all New Zealanders have the right to be healthy both physically and mentally. We include this right as part of the Public Health and Disability Act and our health consumer rights. So, when we see that the health of some of our population is failing, don't we have an obligation to do more, to do better, to ensure good health? Today, I'll be speaking to you about just one group whose health status is not as good as it should be, the health of our rainbow communities, and why it's important that we understand health inequities, how they exist, and what we can do for people when we work to ensure their right to health. I want to give you a scenario. Think about a time in your life when you've had a good healthcare interaction. Was it with a doctor, or a nurse, or a pharmacist? Or was it somebody else in the health sector? What made this interaction good? There's obviously something memorable about it. Did the health professional understand your needs? Did they work with you to solve the problem? Did you feel that you were seen and heard? These interactions are so important. And in an ideal world, this is how all our interactions with health professionals should be. Everyone wants to feel that they can talk openly with the person in front of them and receive the healthcare that they need. But I now want you to think about how things might have gone if you weren't able to get that healthcare that you needed. Would your concern have continued? Or perhaps even gotten worse? How might you have felt if the doctor didn't seem to really listen to you? Or the nurse made you feel less than? What if someone made a negative comment about your sexuality? Or if you asked the doctor about your needs, but they didn't seem to know how to help or where to refer you to? This is, unfortunately, an issue for many in the rainbow community. Our healthcare is not sensitive to the needs of the population, or there's bias or discrimination, and therefore it isn't working to achieve the best outcomes. There are two broad areas where healthcare barriers are present. The first is in accessing care. Can patients pay for their doctor? Is the clinic located close by? Financial and access barriers are major issues in New Zealand. And for our rainbow community, these issues are present too. And they intersect with the general intersections of ethnicity, socioeconomic status, and other predictors of healthcare need in New Zealand. Depending on your income, your lived experience, and where you currently live, you might experience these barriers. Unfortunately, we don't all have access to healthcare when we need it. And one big focus of population health is how we address and fix this. The second area is quality of care. Is healthcare culturally aware of the needs of the rainbow community? Are healthcare providers knowledgeable on what rainbow health issues are? Do healthcare providers affirm and support people's sexuality or gender identity? Unfortunately, the research we have on rainbow health shows some concerning figures. Regarding sexual orientation, for those who identify as lesbian, gay, bisexual, pansexual, and other queer sexualities. The Human Rights Commission in 2020 highlighted that those with diverse sexual orientation or gender identity reported avoiding seeking healthcare due to concerns of discrimination or previous negative experiences in the healthcare system. This is a problem. Where any person feels that they can't access care as a result of who they are, they're being prevented from achieving their right to health. This statistic is furthered by data that shows that half of gay and bisexual men are not currently out to their general practitioner. Meanwhile, 60% of medical schools in Australasia report less than 5 hours of content on rainbow health concerns in their curriculums, leading to clinicians missing crucial competency in how to support members of the rainbow community. If you do not understand the person in front of you, the language they use, or how their health needs may differ, how can you provide the best care? These figures intersect particularly for those who are young, lacking in whānau support, takatapui or queer Pacifica, or for those who also experience potential discrimination in the healthcare system. For those who are transgender, non-binary or intersex, accessing high-quality healthcare can become even more difficult. This community may have specific health needs related to affirming their gender. Access to health professionals who are knowledgeable on trans healthcare is limited, and concerns about prejudice or stigma persist. Beyond this, this population report generally worse health outcomes. Counting ourselves, the first survey of transgender and non-binary New Zealanders, led out of the University of Waikato's Trans Health Research Lab, found that 71% of respondents reported having high or very high psychological distress. This compares with just 8% for the New Zealand population generally. So, by this stage, I painted a particularly challenging situation. Our rainbow communities are not able to access the healthcare we need, and this presents a challenge to achieving good healthcare for all. But I don't just want to talk about the challenges. I want to also talk about what we can begin to do to support our rainbow communities. Now, while I won't list every single initiative in place, I do want to acknowledge what rainbow health-friendly actions can look like. These actions include support for rainbow young people, resources for patients, and education for healthcare providers. It can look like better and easier access to gender-affirming healthcare, sexual health services, and healthcare services generally that are inclusive and friendly to the rainbow community. These initiatives are so important, and they're quite diverse in how they operate. This is important. Our community is diverse, our needs are diverse, and different people need different care. There are fantastic organisations working across our rainbow communities who are ultimately united in the goal to achieving better health. But I do want to focus on some things that we need across the board. We can start by providing a sound evidence base of these issues, identifying where barriers exist and the challenges that people are facing. Stats New Zealand have recently released their first findings from the Household Economic Survey that actually quantified the number of adults who identify as part of the community. It's now suggested that just under 5% of the New Zealand population identify as LGBTQIA+. And the 2023 census will be the first to ask the population about their sexuality and gender identity. This data is by no means perfect. We're not sure that we're actually recognising all members of the community, but we're actually starting to count the population, beginning to ask people who they are, and recognise these differences and inequities. It's more important then that we've got something to do with this data. What can it tell us about the health of the community? And what can we put in place from it? Where are some of the issues in accessing health actually occurring? What are the experiences that our community report? And how can we better this? How can we design healthcare for our community that addresses these concerns? These are big questions. But in healthcare itself, we can start by giving our medical professionals awareness and education on these issues, bringing this knowledge to their minds and equipping them with tools to work with the community. Take, for example, pronouns. We all have pronouns that we use, but making assumptions about a person's pronouns that are wrong can be uncomfortable and in some cases hurtful. Including introductions or signifiers of pronouns into our conversations can be a signal for those who use specific pronouns that they are included, recognized, and welcome in the space. A study in the United States found that transgender and non-binary teenagers found this symbol so important in knowing that their healthcare provider was aware of trans issues, cared about them, and could support their health needs. Or consider how members of the rainbow community could feel going into clinics and spaces designed for us. Events like rainbow community vaccination drives, clinics that are rainbow health competent, or having systems that recognize sexuality and gender identity as part of a person's health profile are so important. Feeling comfortable in health spaces to disclose your sexuality or gender identity and knowing that your healthcare will be responsive. This year also marks the first year that LGBTQI takatapui competency has been included in the entry interviews for medicine, optometry and pharmacy programs at the University of Auckland. We're beginning to ask our clinicians to know about the challenges for the community in the way that they'd need to for any of the population. So, where to from here? I've talked about some of the challenges that our rainbow communities face and how we can support and nurture better health outcomes by providing inclusive, supportive, and safe healthcare. And I want you to know that I say our rainbow communities, because these communities are our family, our whānau, brothers, sisters, cousins, and colleagues, standing in front of you today. Supporting the rainbow community and the right to good health is crucial in how we begin to support each other. I'm here today to ask you to know more about this topic, to understand that health inequities are inherently bad, not just for those who suffer the inequities, but for all of us. Supporting our rainbow communities to achieve good health is good for all of us. It affirms the right to good health. There is more to do. We're only on the beginning of this journey to doing better for our rainbow communities. I care deeply about this, not only as a member of the community, but as a public health student and someone who works in this space. Health is a human right. We can ensure this for our community, allying with us, knowing about these issues, and standing alongside the community as we advocate for the right to better health. We've made progress already, but there's still more to do.